Good afternoon, everyone, and welcome to the 2021 Florida Elder Justice Conference. I'm Kathy Grunwald with Legal Services of North Florida, and along with Christy Bagalow from Florida Legal Services, we are your hosts for this event. We want to encourage you to take advantage of the event feed, the photo booth, the public chat in the lobby. Take a look at the lobby under the video roll for announcements each day. And in the description of each session is a link to a SurveyMonkey evaluation. We hope you'll take the time to complete these evaluations for all the sessions that you attend. The files of each session also include the CLE information for the conference. We're glad you're here, so we're going to get started. I would like to introduce Sarah Halsell, who is the State Legal Services Developer at the Florida Department of Elder Affairs, to introduce our keynote speaker. Sarah?
Thanks, Kathy. As Kathy said, I'm Sarah Halsell, and welcome to this conference. Thanks for being here. I have served as the State Legal Services Developer with the Florida Department of Elder Affairs since 2005. And in that capacity, I've been able to work with many of you, both in the Aging and Legal Services networks, on various projects, all of which serve a primary purpose of improving access to legal assistance for seniors that are vulnerable due to economic and social factors. I hope this conference will help you all to be better advocates and improve the capacity of our programs to serve those that need us the most. It's my privilege today to introduce you to the Secretary of the Florida Department of Elder Affairs, Mr. Richard Prudem. In 2019, Governor Ron DeSantis appointed Secretary Prudem to lead Florida State Unit on Aging. In choosing Secretary Prudem, the governor was choosing someone who was already a leader in Florida's aging network. Richard Prudem had been at Elder Affairs for 8 years prior to his appointment, serving as the Deputy Secretary, the Chief of Staff, and the Chief Financial Officer. From his many years of experience in aging, he is not only familiar with the opportunities and challenges that face older Floridians, but he seeks out root causes of these challenges to better address them head on. He understands that legal problems are often the root cause of some of people's most in-depth needs. We have Secretary Prudem to thank for this conference. Thank you, Secretary, for lending your support and your resources to improve our delivery system. And with that, I'll turn things over to Secretary Prudem to welcome you.
Thank you, Sarah, and a hearty welcome to all of you to the second annual Florida Elder Justice Conference. Many of us were actually together in Tampa for the first time back in 2019. And I remember back then we had a vision for this conference being an annual opportunity to collaborate around elder justice issues. And then COVID comes along. So that really took away our chance to meet together. But good things is we're here today. And we'll be here next year. Hopefully that will be in person. And we hope to be able to continue this very necessary dialogue, as Sarah says, across the disciplines for many years to come. You know, it's been an interesting year, to say the least. We've all had to work to navigate this new world that we've been living in. It's been challenging, to say the least, for those of us who are professionals working in aging and legal services. But just think how much more it has been challenging for those vulnerable older adults. Just as a reminder, Florida is a population with 20.8 million people. 4.5 of those are actually age 65 or older. To put that into perspective, our senior population outnumbers the senior populations of 17 other states combined. So it just shows you the significant amount of older adults that we have here. You know, the average life expectancy of Americans has increased significantly in the last 100 years. But even though we're living longer, we are seeing a growing prominence of chronic illnesses such as dementia, osteoporosis, heart disease, and stroke, and also their associated disabilities. And as many of us know, long-term care is the help needed to cope when those disabilities impair the capacity to perform the basic tasks of everyday life. So the major focus of the programs that we provide at Department of Elder Affairs and through the Aging Network is to provide home and community-based services as an intervention for those older adults who are at risk of being placed into a long-term care facility because of that degree of frailty. I'm talking about services like home-delivered and congregate meals, non-residential adult daycare, personal care, caregiver respite, which is so important. Transportation assistance, obviously legal services, which is crucial, elder abuse prevention, and health and wellness programs. Of about the 4.5 million people over 65, we interact with about 900,000 a year. So many individuals do not need our services at this point. It's interesting though, but all these, even though they're social and human services, they're not medical services, they're still really important. They support the health and well-being of our older Floridians. The disproportionate impact of the pandemic on those individuals has really reinforced just how important they are. At the beginning of the pandemic, providers turned their immediate attention to ensuring basic needs for older adults were met. They included activities such as meeting the needs for steep increases in home-delivered meals, but also staffing grocery and prescription delivery services to people confined in their homes. But once we stabilized those processes, then providers started shifting focus to addressing the social and emotional needs and brainstorming creative ways to address and help mitigate the negative health impacts of loneliness and reduce social isolation in ways consistent with social distancing guidelines. Looking back, what we didn't know a year ago was the vital significance of mental health and well-being, as well as the access to person-centered mental and physical health care. We do now. It's also been the governor's focus from day one is focusing on seniors first because of the disproportionate impact of COVID. And that has been really shown through the vaccination initiative. And right up now, of those people over 65, 85% have actually received at least one dose, which is incredible. And of course, you're sort of seeing those individuals who are suffering from COVID has dropped dramatically. And so that senior first vaccination initiative has really, really worked. As I said, the current population of over 65-year-olds is 4.5 million, but another 10 more years, it'll be well over 6 million. We're talking about an increase of 35%, and there is talk about the silver tsunami, equating those increases in older adults to an economic and healthcare crisis, fueled by concerns about chronic illness and long-term care, and certainly not helped by the fact that COVID has had a disproportionate impact on older adults. And so what we're seeing now is a resurgence of the debate on how much should be spent on Social Security and health and social care for older adults in a society where resources to spend on welfare costs are not infinite and some prioritization is necessary. But unfortunately, what we're seeing, ageism is alive and well and is indeed creeping into our culture despite the very aging of that culture. I think we all agree that age discrimination is wrong. It's insulting. If you deride and don't hire or dismiss people based on their age, it's a prejudice. But it doesn't seem to invoke the anger that other biases do, or the attention of political candidates or society in general, which it really should. After all, I think we may never be a single race or gender, but all of us, if we're lucky, will one day be old. I think the aging demographic should also be touted as a success story of improved health and well-being as our older adults are living longer. It's also a period of growth, development, and increasing subjective well-being despite physical challenges. Before the pandemic, we recognized that the communities that will fare best in the 21st century will be those that both tackle the challenges, embrace the possibilities that an aging population creates, essentially becoming livable communities. We want to be able to live well and age well. And those successful livable communities actually focus on the social determinants of health. You've probably heard about those through the pandemic. Basically the conditions in which people are born, grow, live, work, and age. But they include basic factors like a socioeconomic status, education, appropriate and affordable housing. We've heard a lot about that. Transportation options, safe streets, safe neighborhoods, protection from abuse, neglect, and exploitation. And unfortunately, we're sort of seeing more of that coming to pass as well. But also employment and really the social support networks and combating loneliness and depression. And also, like I said earlier on, the access to personal health care. COVID shook the foundation of those social determinants, but it has increased awareness that aging services are an essential part of the nation's health infrastructure. Winston Churchill had a quote, "Never let a good crisis go to waste." And what he meant was that while the pandemic has created havoc and uncertainty, it has also provided numerous opportunities for rebuilding and reorganization at all levels, and the ability for communities to see the benefits of new and expanded technology with the advent of new programs and improved services. This agency has received significant funds from the federal government and the state to help deal with the issues that arose through COVID. And now the American Rescue Plan continues that effort. especially with the fact that it is also funding the Elder Justice Act through the end of 2022, which is awesome. It positions our state to apply for those grants in conjunction with different partners to enable us to benefit those individuals in need. So I'm looking forward to listening to the presentation on the American Rescue Plan and how we can access those funds to help our clients. But new issues around accessing needed services and supports have arisen because of the pandemic. But there's also been a highlighting of existing issues around access that we also have to confront. So I want to just touch briefly on a few ways that we can make our systems more accessible. Firstly, multidisciplinary collaborations. Second of all, technology. And thirdly, training to enhance the capacity to serve. So looking at multidisciplinary collaborations, if we embrace that no wrong door perspective, we have to reach out to other providers and those advocates around us to streamline the work behind the scenes. In this way, the seniors can get the help they need, no matter where they start seeking for help. I think we recognize these collaborations don't necessarily happen organically. It does take, intention to gather together, whether in person or via Zoom, and learn about what work is being done in the community and what needs are not being addressed, and to strategize together on how we can improve the lives of the people we come into contact with. I think that has really sort of became more prominent during COVID. There is a sort of an urgency, a desire to actually sort of do more, especially when we have significant funds behind us to actually effect change. Usually we get the unfunded mandate. Well, no longer. We have these monies that we should invest in better communities moving forward. I talked about intention. There are communities doing this intentional work, such as North Central Florida Senior Advocacy Network in the Gainesville area. And we're seeing a lot of positive outcomes for addressing the needs of vulnerable people, even changes to laws and policies that have statewide impact. The idea and advocacy around creating the current injunction for protection against exploitation of a vulnerable adult, which is in Section 825, I think. It came out of this local network, and also more recently, House Bill 1041 as well. So you're sort of seeing a lot of ideas and advocacy coming to fruition with new laws that can strengthen our resolve here. But this need to engage across different disciplines is why we wanted this conference to be multidisciplinary in its reach. Second of all, technology. With advances in technology, we have to be mindful about using it to improve access without letting technology further create barriers to needed services for seniors. In actual fact, the American Rescue Plan does advocate more for technology, but more importantly, it sort of talks about access to technology and, like I said, the ability to use it. And so and I thought that was great that they actually had the foresight to stress that. So obviously we will be seeking programs and services that do just that. Interestingly, for many years now, 16 actually, we've had the Florida Senior Legal Helpline as one of our most accessible points of entry into the legal services delivery system. We have a new website, floridaelderlaw.org, floridaelderlaw.org, which is a new resource here at the Department of Elder Affairs. And that website creates an online home for the Florida Senior Legal Helpline, a service actually we have supported since 2007. And soon there will be an online application for Florida Senior Legal Helpline services as well. And the website also houses important legal information on relevant hot topics. And we can be sure there's a few hot topics that have come out of the pandemic, that's for sure. But most importantly, it houses our new Florida Elder Law Risk Detector. And that's a tool that advocates and service providers can use to identify and refer those critical legal needs of seniors. And I think there's going to be more information at this conference about the digital divide and how we're using technology to shrink that divide. And more importantly, how we have the funds to actually do it now. And thirdly, I want to talk about just training to enhance capacity to serve. And I think this conference is a really good example of our commitment to invest resources in training so that programs have the necessary capacity to serve those complex legal needs of Florida's older adults. We now have statewide data on clients served and the types of cases closed with Older Americans Act funding. Soon we're going to have that national data. And the data can and should inform our work and help develop that capacity with the ultimate goal really of improving access to the courts. In 2019, cases closed using Older Americans Act funding in the health law priority category were only 3% of the total caseload. And in 2020, it went up a little bit, but not by much. So I think this points to a need to develop capacity and programs in this area of law and improve referral mechanisms for seniors experiencing legal issues in healthcare. A state legal services developer, Sarah Halsell, who introduced me, I think everyone knows how passionate she is about improving the access to legal services for the underserved. So she'll be working with you to identify ways that we can assist you in your work to create or join multidisciplinary coalitions, especially in response to the funding that's been made available through the American Rescue Plan and also the Elder Justice Act. But looking at creating and joining technology to identify and refer legal needs and being equipped to really serve the needs that come before you. So really, I want to welcome you again. Really enjoy the conference. Get stuck in. This is a one-time opportunity that we will never have again. All of a sudden, the importance of what you do is front and center in the minds of many, many individuals, including those ones that receive the work. But now we have the funding to back this up. Like I said, this is an opportunity to take advantage of this situation and really come up with solutions that are sustainable today, tomorrow, and beyond. So again, thank you for being here. Enjoy your conference, and I'm going to turn you back to that worthwhile duo of Kathy and Christy. Thank you.
Thank you, Secretary Prudom, for joining us today and for your support, and the Florida Department of Elder Affairs for your support for this conference, and Sarah as well for being a part of the team that created this conference. And so, folks, the next session starts at 1 o'clock, and we hope we'll see you all at that session on cultural competence. Thank you for joining.